The liver can be damaged by up to 70%, and a person won't even know it. Because the liver itself has no nerve endings. It doesn't feel pain. Your heart hurts, your tooth hurts, your back hurts, but your liver keeps working itself to exhaustion and slowly dying, and you don't even suspect it. The only things you might notice are fatigue, a bitter taste in your mouth in the morning, and unexplained itching in the evening. My name is Dr.Deepins. I'm going to explain everything in simple terms, so anyone can understand it. I'll break it down in the easiest way possible, and by the end, you'll have a clear plan of what to do. But first, one quick note. In the description under this video, there's a link to my Telegram channel. Everything I talk about here is also posted there. Checklists, guides, written instructions, all in one place. I'm not a blogger. A digital avatar helps with visuals, but everything you hear is based on my experience. So, let's begin. When you feel heaviness or dull pressure under your right rib cage, it's not the liver. First, the gallbladder. The gallbladder is a small sac located right under the liver. When bile becomes thick and viscous, or ducts are constricted by stress, the gallbladder struggles. It contracts, trying to push out thick bile, pressure builds up, and you feel that sharp sensation. Second, your liver has a capsule, a dense outer shell. This capsule has nerve endings. When the liver enlarges, due to fat or inflammation, it presses against this capsule from the inside. The capsule stretches, and you feel a dull heaviness, like there's a brick sitting on your right side. If you're already feeling this, it means the process has gone quite far. The liver is cramped. Now, who's at risk? Most people think, I don't drink alcohol, so my liver is fine. That's a mistake. Number 1 is sugar and fructose. Number 2, medications we take without thinking. Number 3, chronic stress. Number 4, household chemicals and mold we breathe in daily. I see overloaded livers in every second person who comes to me, even those who think they're healthy. The liver performs over 500 functions every second. It detoxifies blood from air and food. It processes hormones like estrogen and cortisol and produces bile for fat absorption. Think of it like this. Have you ever worked where you had 3 times more tasks than you could handle? You focus on the most important and postpone the rest. Those postponed tasks are your symptoms. Now let's talk about stages. Stages 1 and 2 are when everything can still be reversed easily. Stage 1, bile stagnation. The cells are healthy, but bile becomes thick because of low water or stress. Stage 2, fatty liver. Excess carbohydrates and fructose are stored as fat inside the cells. Just like foie gras is made by feeding geese carbohydrates, not fat. Same process in humans. Stage 3, inflammation. Fat inside cells starts oxidizing, literally burning inside them. Stage 4, fibrosis and cirrhosis. Dead cells are replaced with scar tissue. Recovery is very difficult. But here's the key. Most of you are between stage 1 and 2, where everything can still be fixed. Now, I'll show you how to understand what stage you're at, right now, without leaving your home. First, small, bright red dots on your stomach, chest, or back, like ruby red points. When the liver is overloaded, estrogen levels rise, dilating capillaries and creating these dots. Second, look at your palms. Redness under your thumb, and pinky means filtration is impaired. Third, your heels. Dry, cracked heels are a deficiency of fat-soluble vitamins due to poor bile. No bile means no fat absorption. You can take expensive vitamins, they'll just pass through you. Fourth, spider veins on the face, usually around the nose and cheeks. Same reason, weak vessel walls. Fifth, night itching. You go to bed and suddenly your body starts itching. This is not an allergy. When bile can't flow, it's reabsorbed into the blood and irritates your nerves. Act now. The liver is the only organ that can regenerate, even from a small portion. It will recover. Let me tell you about Victor, 45 years old, successful, healthy eater. He was terrified of cirrhosis. He eliminated fats and drank fresh juice every morning, a vitamin bomb as he called it. After a year, he had gray skin and constant fatigue. Diagnosis: Stage 2, fatty liver. Detox happens in 2 stages. Stage 1, breakdown. It takes toxins and breaks them apart. But these fragments are often 100 times more toxic than the original substance. They damage DNA. Stage 2, neutralization. Enzymes package these fragments into safe compounds for removal. Only the liver processes fructose. It blocks stage 2. causing a toxic buildup inside the cells. An apple with fiber is fine, but juice is a concentrated hit, like an IV injection of sugar. How to tell if your detox works? First, reaction to smells like perfume, paint, or nail polish. Second, your nails. Vertical ridges or disappearing white half moons mean weak detox function. 2 quick tests. First, waist measurement, over 94 centimeters for men, 80 for women. Second, press under your right rib. Pain or nausea means a bile duct spasm. Check your eyes. If the white of your eyes is yellowish or gray, that's bile pigment buildup. Hidden causes? First, paracetamol. It depletes glutathione, the liver's main protective shield. Be careful. Second, mold in your home. It releases some of the strongest liver poisons. Don't breathe it. Third, chronic stress. It slows detox and blocks bile. You cannot fix your liver under constant stress. Now, solutions. Let's start with broccoli, but how you cook it determines everything. The enzyme that activates broccoli's detox power dies above 60 degrees. Overcooking destroys it. Correct way. Steam for 3 to 4 minutes. Add mustard powder to reactivate the enzymes. Next, bitter foods, arugula, artichoke, milk thistle, chicory. They stimulate bile release naturally. The liver recovers between 11 p.m. and 3 a.m., but only if insulin is low. Don't eat late. Dinner should be 3-4 hours before sleep. Protein and vegetables, no carbs at night. Start with 2 glasses of warm water. Avoid cold water. It causes bile duct spasms. Wait 30 minutes, then eat a breakfast with healthy fats. This signals the gallbladder to release bile. Drink coffee only after food. On an empty stomach, it causes stress and bile blockage. No snacking during the day. Move every 40 minutes to keep your metabolism active. Sleep on your left side to help digestion. Go to bed before 11 p.m. for liver recovery. Do you wake up between 1 a.m. and 3 a.m.? Write yes or no in the comments. It's a key sign. Save this video. Share it. Sometimes one video can fix years of mistakes. Take care of your liver. It works for you every second. Now it's time to work for it. I'll see you in the next one.